Gio, welcome to the show. I'm joined today with Chief Sneed, Dr. Bunio. Welcome back, Dr. Bunio.
Thank you.
How are things going up at the hospital right now?
They're going great.
Good, good. Well, Chief Sneed's joined us today to pick on you a little bit.
Yeah, I appreciate that.
Chief Sneed, I hear you are quite the, what do you call that when you use your voice to
impersonation.
Impersonation. You're quite the impersonator. Can we get a Morgan Freeman?
Oh, man.
I know you're live too, so you can't back out of it.
I don't know if I can do one right.
No, you do tremendous voices, and we always joke around before the shows and talk about it. Dr. Bunio, you got a new face mask on today.
Yes, I do.
I like it. It's still kind of intimidating.
I'm trying to be intimidating. Is it working?
It's not quite as effective as the last one, but are people seeing you in the street and shaking hands and?
No, we don't shake hands anymore. We just wave.
From a distance?
Yep, 6 feet.
Has CIHA purchased you the traveling caravan yet to put you in when we're out in the hot sun?
No, we're on a bit of a budget.
Okay.
You know, I guess till the casino ramps up.
Chief, how are things going in your world?
Very busy.
Very busy.
A lot going on. Yeah, a whole lot going on a lot of different fronts.
Yeah. So if you had one other, because you've reached the pinnacle of tribal leadership here, you're the chief of the tribe. If there was one other thing you could be doing down the road, what would that dream occupation be?
I think a Cherokee history teacher.
Really?
Yeah.
What is it about the history that inspires you?
Well, I love history. I mean, I think history informs us. I know that history informs us.
Right.
I mean, like the Greeks were the first to recognize that history is cyclical, just keeps repeating itself over and over again. And so I think it's imperative that we continue to educate each generation of what has occurred in our past, lest we be doomed to repeat it. And I think our story as Cherokees has so much depth and color to it. It would just be as an educator.
Yeah. It
would be exciting to me to teach Cherokee history.
Well, I would have lost the bet because I had money on the fact that I thought you would want to be a performance singer. I thought you would want to lead a band. A group.
I do that on the side. That's my side gig. I already do that.
All right, that's true. That's one of your passions. I know we've been on stage together. I've heard you sing a few times. You do really well.
I've got my karaoke set up at the house. That's it. It's therapeutic.
Bunio, what do you do? Do you have a karaoke machine?
I do not.
Okay, so what would you're a doctor. You've done this for a long time now. Is there ever been another career you were ever interested in or thought about? I'd like to try that sometime.
Well, I was always interested in broadcasting, so I thought, take you could help me out with that.
Take Chris's job.
You're on the way.
Sanjay Gupta. I mean, he can't go on forever.
What were we calling him before the show? He's Cherokee Fauci.
Cherokee
Fauci.
That's right.
It might catch on.
Hashtag Cherokee Fauci.
Yeah.
That's right.
So broadcasting?
I think it would be interesting to educate people on a larger scale.
Okay.
One of the things we enjoy as doctors and nurses is people tend to trust us.
Yeah.
We just try to tell the truth and use science as best we can, and so I think there's power in that, and I think there's a need for that.
Absolutely, and I hope we can have a platform here to continue to have these dialogues, because I do think we do some wonderful work as far as getting this information out to the public.
Yeah.
And so that you're going to have that opportunity to kind of tie those two career paths together.
Yeah, thank you. I'll let you know when we get syndicated.
And then we'll have the chief do us a little jingle for the intro.
Absolutely.
Yeah.
Then I can narrate my Morgan Freeman voice.
And then do a Morgan Freeman narrate us in.
Or my Perry Shell voice.
Let me have a Perry Shell. Can you do one?
Oh, gosh. No, I don't want to embarrass myself.
Somewhere in the show we're going to get a Perry Shell out of you. So we're here today on a serious matter to talk about the way we interpret the numbers and show the reporting to the public on the COVID-19 dashboard, I guess. What can you say that? We're going to go ahead and pull up the first one to kind of talk about what the rationale was behind that.
Well, in discussions with the leadership team at the hospital and with Public Health and Human Services, first I want to say I think Radonna Crow's done an outstanding job of getting that information out on a daily basis to the public. But oftentimes, just the numbers don't tell the whole story. And of course, we see the increased number of cases, and I understand, the reaction from the public. There's a lot of times fear. And so we wanted to present the data in a way that's easily interpreted.
Okay.
But I think equally as important so that our citizens understand that the decision making that is occurring is being data driven. So we're trying to avoid is being reactionary, and instead looking at what the data is telling us over a long period, and then allowing that to drive our decision making.
Very good. So on the and you're right, to create policy from the data is the ultimate goal of all of the things that we do in the tribal side of it. And we lost our laptop here. Miss Ashley, you might have to sign in for us.
We have a special guest.
We have a special guest on the show today.
So, dead airspace.
Dead airspace time. So we have to fill that with some Perry Shell, I believe.
Oh, gosh.
Listen, I think we're going to need to have a work session on that. Bring that back to the floor. We can vote on it again.
Perry, I hope you're out there listening because this is good stuff. We do this all the time. Dr. Bunio, do you have any impersonation?
No, I do not.
Oh, okay. Just you have the voice of gold, so you don't need to really.
I'm just hoping that the chief doesn't start impersonating me.
That'd be a tough one.
Yeah, just
we'll start working on that.
Yeah.
So let's talk a little bit about this first slide here. What are we seeing on this?
Well, I don't have my glasses on, so I can't tell you what we're seeing.
Okay.
Oh, okay, there we go. So that I can
Technology.
So we wanted to show in graph form some very important data points. Of course, the overall number of positives, and keeping in mind that's from March 1st to present.
Okay.
Again, equally as important, the number of recovered, and then the number of hospitalized, and then, of course, the number of fatalities or deaths. So the average that we're seeing over time is we're kind of averaging somewhere between 25 and 30 active cases.
Okay.
So the larger number, people need to understand that is from March 1 to present.
That's a cumulative number.
Yes,
there.
it is. Is
Okay.
that 93 or 98?
93.
93. But there are 67 recovered.
Okay.
So again, we wanted to put it in a format that's easy to just look at and as a graph and say, okay, well, that makes sense now. And I think it's also important that the number that are currently hospitalized is a very low number.
That's a really good measure, and it's a really low number considering the other numbers that are happening around the country.
Right, because keeping in mind initially when we made the decision to shut down, the purpose was to ensure that we didn't overrun our healthcare system.
Correct.
Because of our limited capacity. And then also in Western North Carolina at that time, there was a very limited number of ventilators. I think the number was 36. Is that correct?
It was pretty limited.
And it was from Haywood County West. There were only 36 ventilators.
Oh, wow.
And when we were looking at the projections, that if we did nothing and we just kept operating business as usual at the tribe, at the casino, and all of our operations, the projection was that by the 3rd to 4th week of April, we could have as many as 400 positives.
Oh, wow.
So we flattened the curve, which is very important, but to now see that with the measures that we have in place with social distancing, shorter work week, the mandate to wear masks, we have a contract with a company to sanitize workspaces.
Right.
We have protocols in place that when we do have a positive, there's an immediate response team to come in and to do mitigation. And we're seeing that the number of hospitalizations, again, extremely low.
Okay.
And then, of course, the number of recovered is a fairly high number.
So in the second slide here, we pull up, we see more of these three horizontal lines here. Total positive, total recovered, and current active cases. What's the key takeaway from this?
Well, I think anytime you're looking at data in a linear format, you're looking for trends going up or down.
Right.
And you can see with all of these that they're mostly flat.
Right.
We're not seeing any
spikes.
Right.
Okay.
There's no exponential curves up or down. It's just kind of trending pretty flat.
Okay. Good deal. And I think the active cases is really important there, and it speaks a lot to that because at one point, we had 32, but we're down in the 20s, the lower 20s now. So we're not seeing that spike. And is that what you're kind of seeing there, Dr. Bunio?
Yeah, we're seeing sort of just a regular trickle of new cases. So as somebody recovers, we get a new case. So we talked before about the R number or the R naught numbers. That's the number of people that someone with this virus will infect.
Right.
You want that number to be 1 or lower. If you can do that, if it's at 1, the virus is just going to continue pretty much forever. If it can be below 1, the virus starts to go away.
Starts to fade in the population.
On average, worldwide, the average number of people that one infected person infects is about a little over 2.5. So some of the things that we're doing that I think we'll touch on, the contact tracing and isolation, it's working.
Good. Okay.
Well, another point on that as well is that the public needs to be mindful of the fact that here at the Eastern Band in Cherokee Indian Hospital, we're testing at 4 to 5 times the penetration of the state.
Okay.
So our level of testing is far beyond the target for what the state of North Carolina is trying to achieve, and also too, when the daily numbers come out in the current dashboard format, sometimes you'll see 5 new positives or 6 new positives, and then I think appropriately that people are concerned about that. What the public needs to understand is that sometimes that we're testing 100, 200 people in a day, and then you get this massive results back.
Right.
And then on that one day, it looks like, oh my gosh, we had 5 positives. Well, that's actually 5 positives out of 200 or so people that were tested.
Gotcha.
So
Are you still seeing a backlog or a slowdown of the testing results coming in, Dr.
We're
Bunio?
seeing that nationwide now that the whole country and some states are in really rough shape, and they're testing at a much higher rate. So these big labs are backlog. Test results, sometimes we'll get them back in 2 or 3 days. We've had some taking about 12 days to come back
Wow.
now,
Okay.
which is a long time.
That is a long time to wait.
Yep.
Okay, and on the next one, we have a lot of color, which I'm excited about.
I'd like to thank Vicki Bradley for her input.
Did she present the color wheel on this?
She did. She did a great job.
It's beautiful.
So the colors initially were more a soft pastel earth tones. She said they need to be more vibrant.
They need to pop.
They do, and these do. They definitely pop. So this is number of positives by community. What's important to note on this slide is that it doesn't account for the number of recovered. This is a cumulative number of positives by community.
Gotcha.
And this was the purpose for this slide was that we're just listening to the public. So our citizens wanted to know. They expressed that to the vice chief. They expressed that to some council members.
Right.
And so this is
a response to that. It's just like,
direct
here's
result.
where it's at.
Yes.
What does that tell us, Dr. Bunio, about testing efforts? Are there ways to say, certain communities are testing more folks than others, and that we can start to call to action some of those communities?
We can, and we're going to start capturing some of those data points that we can share that. But we'll see. We have seen spikes, when we get positive cases. I know one time in Cherokee County there was a big push, and we got a large percentage of the population tested, and we appreciated that.
Good.
So yeah, we can do that.
Well, another point to look at on here as well is in our case count, the largest graph on there, the largest cumulative number is other. So
Right.
Yep.
our citizens need to understand that we are also testing people who don't reside on the boundary.
Right.
Maybe they work on the boundary, or they are in relationship with somebody on the boundary, and they're tested at our site. And so they're counted in our case count, but the other is the largest.
That's true.
The largest segment.
Good. Okay. Good to know. Now on the fourth slide here, we got patients by. This is an interesting one. I really like this.
Agreed. That was a very telling slide.
It is.
So when I saw this one, what I was most pleased to see is that when you get into the our elderly population,
Right.
the numbers are much lower.
Yeah, they're pulled back some.
The very telling one is a trend that is happening nationwide, which is our 18 to 21, 24, 25-year-olds.
Right.
That number is the highest here locally, but that's also a trend that's happening across the country. And I think the reason being was early on, and this is just anecdotal, but early on it was, well, this only affects older people,
Right.
so young people, you don't have to worry about it, right? And also when you're 18, 19, 20 years old, you think you're 6 foot tall and bulletproof. We see that same trend happening here.
Good. Dr. Bunio, are you seeing a lot of this age group testing as well? Is that also happening?
We are. So a lot of times we find a positive case, sometimes in this age group, and it's tied to like a cookout or a family
So peer
gathering,
group.
where maybe they didn't follow the 3 Ws
Gotcha.
that we've talked about. And so, so I agree with the chief. What we're seeing here is a younger population. They're catching the virus. They don't tend to need hospitalization, so our hospitalization rate is down.
Okay.
But they're out there potentially spreading this, and we've also talked about the number of people who are asymptomatic that can spread the virus.
Right.
And I think in this younger age group, they don't feel that bad. We're picking them up. They're coming in for testing, but this is a fraction of the people that have the virus out there in the community. We
Right.
know that. So universal masking, we've talked about that before.
Okay. Keep going with that.
Yep.
All right, and then this last one has a lot of color and squiggly lines. So tell me about this one, Chief.
Well, this slide is actually Harvard slide. Is
Yep.
that correct? So the reason we like this one is you've got at the bottom green, yellow, orange, and red.
Okay.
So this is showing a trend over time on the y-axis, And as you can see, for a little bit there, we were spiking up in the orange pretty high.
Right.
When we get into this, when we get close to the red, we've got to start making some decisions.
Okay.
So one of the reasons for all of this new presentation of the data is because when our citizens were seeing, just as I mentioned, like, oh, we got 5 new positives or 6 new positives, the first question that myself, the vice chief, council members are getting, are we going to close the tribe again? And it's like, well, no, not yet.
Right.
That's not off the table. But what we're looking at is the data over time. And as you can see here, we're actually down into the yellow now.
So the red line is the one we're looking at? Yeah, Turkey.
Yeah, so we're actually trending down now, down into the yellow.
So so we were coming out of a spike here. It looks like the efforts that we made to slow things down dropped it in, and then we reopened slightly. It came up a little, but it looks like it's starting to taper off here.
Yeah, and I think another way to interpret that as well is, if you keep in mind, if you look at the dates, this is where we really started pushing testing, and we started getting a large response to testing as well. So you're going to see an increase. And I think also, too, mandatory masks and people beginning to take seriously social distancing, sanitizing, wearing masks, we see that trend coming down as well, even though our testing is still at the same rate that it has been.
And looking at it as well, it's impressive compared to North Carolina's. We're starting to dip down a little bit. It looks like North Carolina's kind of taken off here.
Right, and that's a good point to bring up as well. We are doing testing at 4 and 5 times the rate that the state is, and we're trending down. Now, point Dr. Bunio, when we discuss this, is he always brings up that we as citizens control this data point right here.
We as citizens control the data point.
That's right. Our actions or inactions will determine whether or not that trends up or whether or not it trends down.
That will then drive policy that the government or other organizations have to use for us to have to live within.
Right.
Okay.
Or I like when we were just talking before we came on, in conversation, it's like we're not merely spectators of this data point here. Our behavior is driving that data point.
We're active participants.
That's exactly right.
Okay, so when will we start to see some of this coming out to the public?
I think our plan is to have it posted by Friday.
Okay.
But it may be as early as tomorrow, but certainly by Friday. This will come up on the dashboard now in the daily reports.
Excellent. So this is a new way to look at things. I love the fact that we're studying comparatively. We're looking at age groups. We're looking at communities now. And I think it's important to have that data. Why is it important to have that data out there? I'm saying this like I'm the doctor in the room.
Well, we've talked so many times, I think you know all this stuff off by heart by now, Chris. So it's important that the public knows the current state, and I think some of the earlier slides really tell us what's going on. This one is sort of like what's happening over time, and the public can look at this and say, is that line going up to where we may have to take some action, or is it flat or going down? And I love this slide because the color coding is really simple and easy to understand.
It is. Red
is bad, green is good, and then when you're in between, yellow is cautious. When you're in the orange range, this model says you may have to do something, but if you have a really good contact tracing and surveillance team, which we have built, members of the public have probably gotten phone calls. We've said before, when the hospital calls you, please answer the phone.
Right.
Please share with us your contacts. We're not trying to get anybody in trouble. We're just trying to control this. If the community cooperates with that, we can stop that line from going from orange to red. And in fact, what we have been able to do is get it from orange down to yellow.
Nice.
And just, in order to message this, I think, like you said, this is going to be coming out regularly. My wife has offered to get me 4 masks of different colors, and I will wear the appropriate color every week.
And stand by the road down by the BIA building. So
I just thought I'd do it here. But I can do that if you want me to hold the sign.
Well,
with a big arrow.
They have the sign down there for the forest fire threat.
Yes.
And I think it would be just appropriate to have you there with the threat of COVID-19.
Yeah. I'll do anything to protect this community.
You're a team player, and I like that.
And again, this one really, the community can watch this, and they shouldn't be surprised. They can watch this over time to see, are we doing well, and the community controls a lot of this.
Okay,
so,
good.
Again, it's simple stuff.
Well, we all have to do our part in this, and it's good. I appreciate you guys for bringing this forward and giving us some data to look at. It's better than just a number. Now we can actually see where we've come from and where we're heading, and hope yellow side, or hopefully get it down to the green
Absolutely.
and
That
get
would
this
be
thing
an
off our plate.
accomplishment.
But well, thank you. I mean, I know we started this out lightly, so I think I really appreciate you working with us to have some fun with this. I think it's important to let the public know we're human and that we have some fun, and that this is a serious matter, but we are them that we're here.
Just to mention that it's Monday, Wednesday, and Friday.
Correct. So this will be coming out on Monday, Wednesdays, and Fridays from here on out. So the public will not see this every single day. It will be loaded.
All right.
Just that here again, it's each.
Well, we'll take it this thing back. If you have any comments or questions for us, post them on. If you have any concerns at all,